I've suffered depression all my life. Nothing works. Is there any new treatments available? What is psychedelic assisted therapy?
It's actually a very good question. What we've started to do in Australia in particular is Australia is the first country to legalise the use of psychedelic medications for certain conditions. So psychedelic medications are things like psilocybin, magic mushrooms, MDMA, which is ecstasy. There are a whole raft of other psychedelics, but the ones that I will focus on for yourself is basically the MDMA and psilocybin, and more specifically psilocybin. And what it does is induce a state in which you increase neuroplasticity and allow connections to be made in your brain that allow for healing. Now, there is a lot of evidence that the medications that we're using don't work. The Cochrane review from, I think, 2013, 2014 showed that a lot of the medications are no better than placebo. Here we have a medication that appears to not only help considerably, but in some cases, and the investigators into this are saying they don't want to use the term cure, but we're talking about people going into remission for prolonged periods of time. But it's not just simple a matter of taking the tablets. There's a lot of work to be done. It is a lot of hard work that needs to be done. So the whole process, and it takes months.
Why did Australia allow it?
Again, a very good question, because a group of individuals in Mind Medicine Australia approached the TGA and said, can we legalise these medications? And the TGA responded, after they made the initial application, the TGA responded and said, well, no, because you need to fulfil these criteria. And a particular gentleman went, okay, and he answered all the points they raised and went, there you go. And the TGA had no other response other than to say, okay, yes, we will legalise these. But it's very, very sort of structured and ring-fenced. So what you have is psilocybin to treat treatment-resistant depression and MDMA to treat PTSD. But the only people that can prescribe them are psychiatrists that have undergone the training as per Mind Medicine Australia. So there's only a few psychiatrists that can actually prescribe this medication, which unfortunately will mean for most people the cost at this stage is exorbitant, unless you can get onto some form of trial. Now, here in Perth, there is a trial for MDMA to treat PTSD, but the trial is full. But clinics are being set up. But my concern is that, and I already know that the price range is somewhere between $25,000 and $35,000. So it's a little bit pricey for the average individual at this moment. But if I get back to the other process, the whole process for you would involve you going to see a psychiatrist who would assess you. And then they would build up a bit of a rapport, possibly with you and their therapist. And that's called the set. So that they sort of have the process, which may take a week, 2 weeks, a month, where they explore the issues that are in front of them. And you point out what you desire from the form of treatment. You would have a medical examination just to make sure there's nothing wrong. There'd be questionnaires to fill out to make sure there's nothing that is contraindicated in your particular case. And then would come the day of the treatment, and it would start early. You'd have a room which is set up for it, which is the setting. So you'd have possibly a bed, possibly a couch, possibly eye shades, possibly earphones, whatever that you would want. You would talk to people, and there'd be this discussion about what can and can't happen. So if you were having a a moment of anxiety or fear, it would be already pre-sorted out whether they could touch your hand, whether they could touch any part of your anatomy. It may be if someone was, particularly with PTSD, they may not want to be touched. So there's ways of talking to the person, and you try and sort all of the issues out before you got to the actual therapy session. Then you'd be given the medication. Now, as I said, it would be done in the morning because the process takes 6 to 8 hours. And there'd be 2 therapists there. One of them may or may not be the psychiatrist. My suspicion is probably not. So you'd have 2 therapists there that you would already know and trusted. They would sit there, and their job is not to guide you. You are the person that's taking the journey. So they are there to support you. There is no guidance from them. They are bringing their presence to the situation, and they're holding a space for you in which you can experience the process. After the process, after the 6 to 8 hours, they would make sure that you're okay. In some places in the UK where they do the research programs, you stay the night. Sometimes you don't, depending on how you are. And then you undergo for the next couple of weeks an integration process where what has come up is integrated by the counsellors. Usually there's only one for these sort of sessions. And you talk about it. Again, they're not trying to guide you. You would raise questions, and they're trying to talk about what came up, what they witnessed. Sometimes it is useful to have the process videoed so that you can actually go through. But again, that would be with your permission only. And then after another 2 weeks or so, there would be a second therapy session. And again, the same process of integration afterwards as well. And quite often, they use a very low dose in the first session, and they possibly use a higher dose in the second session, depending on what's come up. And again, with your permission, again, with the whole, talking about it, getting you to sign off on that and what can and can't be done. And then, again, another integration session. Now, sometimes a third session is required, and again, usually that's not strictly necessary, but that sometimes happens. And then you go back to your life after you've had the other integration. And that whole process, as I say, can take 3 or 4 months. So that's what you're looking at for the actual process.
Does one process fit all?
Well, no, they usually tend to keep it at 2 or 3. But genuinely speaking, there's no one size fits all because what comes up is different for every single person.
What if you have a bad trip?
Depends on who you talk to. That's a very interesting question, because there are some therapists who believe there's no such thing as a bad trip. They believe that the learning experience is far more difficult from that particular process. And that's why you have the 2 people there to assist if things are going awry, if you're getting anxious, and they can witness it and help you through that anxiety, that fear, whatever may have come up. So they are there to actually support you in that. There have been sort of episodes where monsters have appeared, for instance, and then you talk about that with the person who's undergoing the experience, and they try and talk you through the process of what the monster is and what it might represent in that circumstance. But they're all a learning experience. From the medical point of view, it's incredibly safe. People do not have adverse medical responses to it. And if there are, you do it in a setting where you do have resus gear. But the episodes of that are minuscule. The other thing is that we're all aware of the stories of people who are take magic mushrooms and and potentially jump off things. Again, you've got two people there who are going to talk you through the process, who are not allowing you to jump off something. So the actual process, all the medications are incredibly safe. You're not, with the MDMA, for instance, with the PTSD, there are some cardiovascular effects, but again, they're minimal. But people talk about, people going to rave parties because it is ecstasy, but they have their responses because they're dehydrated. And they're often taking other drugs. It's polypharmacy, and so other things can occur. But MDMA, which had a very big, sort of had a bad rep, particularly in the 1980s when it started to be a party drug, it's a very safe drug. So from that point of view, you can be advised that it's a safe process, it's an effective process, far more effective than anything that is available to you through Medicare. The problem at the moment is cost.
How does it work at a psychological level?
There are certain pathways within the brain that it does work, and what's fascinating is that even though all the psychedelics work through slightly different pathways, so the psilocybin and the MDMA work through slightly different pathways in the brain, the end result where you get to with the psychedelic process, it seems to be the same. And nobody can quite explain that particular reasoning. But what that then leads to is increased connections within the brain. And the experience quite often is a religious one. And this has to be, if you were, for instance, an atheist, that has to be mentioned to you as an atheist, because you may suddenly be experiencing a deity, which may shake you up. Who knows? I don't know.
Religious or spiritual?
Again, good point. Spiritual is probably a better way of actually phrasing it, yes. But again, you have to warn somebody who is an atheist that they may experience something that is spiritual.
Being cost prohibitive, it's not something you'd recommend for people to self-medicate for purity and toxicity reasons.
And for other reasons, because again, the whole process is required. You need the setting, the integration. So it's not just about popping the tablet or pill or consuming a bit of mushroom and having the experience. It's the whole process that's required to get the maximum effect. People do obviously take these things and have an experience, and it can be beneficial. But to get the maximum amount out of it, you need the whole package, unfortunately. This is slightly off topic, but there are clinics who offer, pain clinics who offer ketamine, and they do give it to people, and ketamine can give you a psychedelic experience. But they're omitting the setting, the integration, which is a little bit questionable, because again, you're missing out on everything else that's required or seems to be required. Some people ask about microdosing, particularly of mushrooms. The problem with that is it's in this country it's still illegal. Even though psilocybin, the full-on psychedelic experience, is, microdosing isn't. I'm not sure as to why that might be, but microdosing, again, the evidence is that there are some benefits from it, but it's not, again, the full package. It's minimal improvement over time, and you just have to take it over time, and it's a totally different process, a totally different workup for that.
Do you see this becoming more affordable for people?
I would hope so. I've spoken to a number of people who are wanting to try and organise clinics where the prices are a lot more affordable. What I'd like to see is bodies like insurance companies realising that there is actually savings to be made in the long term. If you can not have to pay for someone who's taking time off work, for medication, for therapies, there will be massive savings long term. I dread to think how much Medicare fork out for all the counselling that is done at the moment in the country. It's mushroomed. I'm sorry, that's a pun I didn't mean to make. But it has grown enormously, particularly over the COVID time. And again, if the government embraced this would potentially save them money in the long term. DVA with PTSD, again, there are cost benefits to all of this. I don't have those figures to hand, but it's a no-brainer that if you can get somebody back into society and working, then that's going to save money instead of them being on long-term medication, which A, doesn't work, which has potential side effects, quite enormous side effects. It's a saving, and society as a whole benefits from this.
What would be the ripple effect on society?
You have the potential to have massive societal change if it was allowed to happen. My suspicion is that it won't fully because it'll be prohibited by cost, and I don't think insurance companies and the government will embrace it because they won't see the cost benefits. If you have an individual here who has, say, depression, it acts as a black hole, if you like. It affects not only him or her, but their immediate family. That in turn has an effect in a wider group. So you have a little bit of a ripple, a negative ripple, if you like. If you can cure or possibly change someone's life significantly, then you have a positive ripple here. So you have this little ripple that has an effect on their family. They might stop drinking, for instance. They may stop drugs. If you have another person over here doing the same thing and changing the negative ripple, the black ripple, whatever, to a white ripple, a positive ripple, and you get enough of these happening, that has the potential to change society for the good.
Will Big Pharma try and stop it?
Again, a difficult question to field because I don't know what they would do. You may be right, but they may try and come on board via synthetic agents to mimic MDMA and the effects of psilocybin. I don't know. What I do know is that we have these agents that have been extensively investigated. There are thousands of papers showing their benefits, thousands of papers showing how the safety factor. And some of these things go back literally thousands of years. They have been in society, various agents have been in society for thousands of years. And there is actually one school of thought that does believe that man became the thinking creature that he did as a direct result of mushrooms, because there were someone picked mushrooms that were found around wherever the cave, whatever. They had these experiences and increased the interconnectedness of their brain, which allowed them to go a certain pathway. Now, I'm not saying that's true, but that has been an idea that's been postulated.
What other uses could there be for this treatment?
The other uses, now, these are off-label uses. These are not legal. I have to reiterate that. They're not legal. However, there are off-label uses for for some of these medications to increasing connectivity. So early dementia is an area that they're having some positive outcomes. But it doesn't stop there. There's evidence that they're using this in kids with, young adults, I should say, because they're not using it in children, with autism spectrum disease. To improve their thought process is to allow the concrete thinking that they have to be more malleable. So there are other processes. There are other agents. For instance, ibogaine, which is an African herb, shows great promise for getting people off opiates. So this field has a massive potential across all aspects of medicine, if you like. We're also looking at the legal use of mushrooms, for instance. So lion's mane seems to have an effect in ADHD. Some mushrooms appear to promote and improve immune function. So if you use combinations, including things like cordyceps and turkey tail, they improve immune function. Turkey tail seems to have an effect. It by itself potentially has an anti-cancer effect. It's not been fully investigated. But these are all areas that are unfortunately underfunded because you can't make vast amounts of money from it because it's a natural product. But there's an exciting area of research in all of this. But definitely for things like dementia, early dementia in particular. But again, you've got to be careful. You can't just rock on up and go slam it in because you have to do the work. You have to identify what sort of dementia it is because that's important. They need to take other steps as well. There's a guy called Bredesen in America who has his own protocol, which is quite an expensive protocol, but it shows some benefit. So if you're marrying these things together, who knows what can happen?
What's the future for this kind of treatment?
The bizarre thing is it's not new, but we know. But as a new therapy that is legal in this country, my hope would be that it is embraced and made available to people at a cost. Well, hopefully Medicare will cover it. And it's rolled out countrywide. It won't be, but that would be my hope because it would be incredibly beneficial for people.
Why has it taken so long to be allowed?
I think because of a number of issues that happened, particularly in the 1960s, 70s and 80s, where the early psychedelics got a bad press, particularly LSD, which was used for, shall we say, slightly nefarious purposes as well as everything else. And then it became viewed as a party drug, and then it got banned. And a lot of the other agents were shoved under the same umbrella, even though they worked differently. MDMA, because in the 1980s it became a party drug, and again attracted, and it seemed to, people had some side effects which were then blown out of proportion. So the whole press, if you like, in the past was negative, and people have fought and looked into it. There's researchers from the 1960s who have been fighting for a lot of these agents, and people from the 70s and 80s. One of, some of the guys that we were talking to on this particular course were 70 and 80 years of age, and had been fighting the fight for decades to try and get these medications accepted and legalized. And without, all of them have said Australia's lucky.
Why Australia and not other countries?
again, because of the particular people who were at Mind Medicine. They saw a vision and they went for it and managed to get it over the goal line.
Does LSD have a place?
Obviously, potentially, yes. But again, the bad press about LSD is such that I don't think it'll ever get accepted and legalized. But if you remember what I said earlier, is that all of these psychedelics get you to that place. Well, LSD does get you to that spot, allowing the neuroplasticity and allowing for change to occur, allowing for you have to have the ability to allow the change to occur. So, yes, it could have a place, but it never will, because it has had worse press than anything else. We may find that we may be able to use ketamine down the track because it's already used as an anaesthetic and for pain relief. So there is a modicum of acceptance of it. You can use nasal ketamine for depression. The problem with that is it's quite expensive and you have to jump through some loopholes. But at least that is available for people to treat their depression. And it's having some benefits. But again, it's costly. And you have to undergo training from the drug company concerned to actually administer it.
Will people need top-ups?
At this moment, people go into remission. As I say, I'm hesitant to use the word cure. Go into remission that lasts a very long time. So the idea of top-up treatments, it isn't necessary because they've had this remarkable change, this ability to actually make these new connections and to address, for instance, the agents that may have triggered off the process, particularly in PTSD, and make the changes. I'll quote you one example that I can actually talk about. There was we were shown a video, and it was a guy who was an alcoholic, and this was from about 4 or 5 years ago. And his alcoholism was based on a traumatic event that happened when he was 11 or 12. And basically what had happened was his mother, this was in the UK, had been raped and murdered downstairs. And the murderer came upstairs, stood at his door and looked at him, and he just lay there. And he froze for about an hour and he couldn't do anything about it. He went downstairs, found his mother, called the police, and he hid his trauma and his guilt in alcohol. He was obviously a functioning alcoholic because he was able to hold down a job, but it had a direct impact on his family. So his sessions were with, I believe, MDMA, and again under the umbrella of an experiment. He had 2 sessions, and at the second session he was looking at a particular part of his brain, because MDMA seems to have an effect on this particular part of the brain, the hypothalamus, and takes away that fear and flight type process or diminishes it. And he was able to almost exorcise his demons. And after the second treatment, he never went back and touched alcohol. This was 4 or 5 years ago. There was photographs of him as a totally different person, smiling, happy. He has become an advocate. He's gone on various programs to talk about his experience, and it was just literally mind blowing. And I can talk about him because he gave us permission to do that. So it was incredible. So, and he hasn't had another. He hasn't had to have another bout of MDMA. He had his 2.
Is there anyone this isn't for?
There are medical restrictions at the moment because you're not allowed to have it if you've got unstable heart disease, if you're pregnant, if you have active psychotic disease, and possibly a past history of schizophrenia with psychosis. if you're on certain medications. So those are the some of the guidelines that we have in place at the moment that you cannot have. The active heart disease is an interesting one because there's a bit of grey area there. You know, ischemic heart disease, no. Probably severe hypertension, no. But if you have some conduction defects, well, we don't know. But at the moment, it's all lumped under, no, you can't. So medically speaking, there are restrictions, yes.
The initial cost outlay could be recouped by returning to work.
The other possibility is, not necessarily for you, because I understand that you're still working, but if you weren't at work, if you could scrape up the money, then you could get back to work and actually recoup that loss. So it's a possibility for you as for some individuals to go down a pathway, even though there is quite a large outlay, because in the long term, you can get back to work and make a living and improve your own feelings about yourself and the feelings of self-worth.
Are there any rejuvenation properties to the brain?
With some of these agents, particularly ketamine, there seems to be increased neural development as well. So there does seem to be some sort of regeneration process, and it seems to be more particular to ketamine. Now, again, the obvious question for that is, will that have an effect in dementia? Don't know. But there is research ongoing in that process. And it's very exciting because I happen to know a little bit about, for instance, hyperbaric oxygen. And I know that that is useful to treat PTSD and depression. In Russia, they use hyperbaric chambers that is insurance-backed to treat depression. Now, there are studies that show that in depression and PTSD, your cytokine levels go off the scale. So there's an inflammation and inflammatory process going on in the brain. The hyperbaric oxygen reduces that. But as far as I'm aware, there are no papers looking at the combined effects of hyperbaric oxygen and ketamine as a way of improving cognition and improving the processes in dementia.
Do hyperbaric chambers aid in reducing inflammation?
The ketamine already does, because it's useful. It's used in pain clinics to help with people with chronic pain. If I go back to the hyperbaric oxygen, it also helps with some pain syndromes. I've seen that process work with, for instance, in people with peripheral neuropathy secondary to diabetes. I've seen people in pain, chronic pain for 3 years, walk out after one treatment with no pain. I've actually witnessed that. The person walked out of the room, paused, came back in and said, "I'm not in any pain." So it is something that I have seen. But this is a whole different sort of area. But would interestingly dovetail in with the use of psychedelics.